Hi, my name's Kelly Greytok. I'm a plastic surgery recovery nurse. I travel around a few different states and I recover patients after plastics or cosmetic surgery in their home or hotel room. And today I'm talking about pain. And this is a really big topic, and I really am hoping after watching this, you are a little less anxious and a little bit more prepared for what you can do after your procedure to kind of help you get more comfortable. And just kind of going into your procedure knowing you've got some kind of things in your back pocket that you know you can rely on. So please hit subscribe if you want to follow me for more tips, tricks, and just foundational information on how to have a great recovery after plastic surgery. Okay, so pain. I think this is the topic more than anything I hear from patients when they call me and they are worried or feeling anxious. It's even something that they're more concerned about than getting a great result. I think obviously when you decide to have plastic surgery, that's your goal. But then once you decide to have it, I think people kind of start worrying about the pain aspect. First, let me tell you, there is a big difference between pain and discomfort. And a little bit of discomfort is normal, and it's really gonna be okay. I also want to just give you some quick statistics because I'm big on the numbers and I recover tons of patients. I would say 25% of my patients don't even use narcotics after plastic surgery. They just rely on Tylenol or whatever their surgeon and whatever non-narcotic medicine that their surgeon recommends. And then most of my patients that do use narcotics, we use them pretty sparingly. We, space it out or use half a pill or use the minimum dosage recommended. And then the patients that do really rely heavily on the narcotics, and there is no shame in that, really only use them for a few days. So that's something that just to give you that perspective. And also I want to tell you one thing, that when you are taking those narcotics, and this is another video, but I just want to make sure, you really want to make sure you're taking a stool softener because there's a lot of discomfort that can come from getting constipated. So that's one thing to avoid. Side note. Okay. So back to pain. So, of course, whenever you have an incision or you're kind of cutting into or penetrating your body, you're going to need to heal, and the healing process can have some discomfort. A lot of times with all different types of surgeries, sometimes your surgeons can have you in a compression garment or have you, like if you have a facelift, they wrap you. Sometimes they wrap you pretty tight. That is something that's actually going to help keep swelling down, which is going to help manage your pain. So definitely keep that bra on or keep that compression garment on. And if sometimes when you're in bed, let's say you have a compression garment around your waist, kind of a binder, and that you can open up, you can make it tighter. If it's not tight enough, it will really help you feel supported, and it will also really help keep your pain down. Another thing that is so helpful is icing. Now, a lot of times, most of the surgeons that I recover for are big on icing, and that's something that I really focus on to help keep my patients keep the swelling down and help kind of stay ahead and keep the pain under control, or kind of nip it in the bud before it becomes a problem. Every surgeon's different. Some surgeons don't want you icing at all. Things definitely evolve over time, wound healing and all these different things. So you definitely want to follow your surgeon's orders. But here's what I would like to offer you. Let's say you're one of those people who your surgeon doesn't want you icing your face. Let's say they have you really wrapped up. You can definitely pop an ice pack behind your neck. And you might be thinking, why would I want it back here if I'm hurting up here? Trust me, it will help you feel better. You also can, if you have any work done to your chest and they don't want you, icing this area or the incision lines, you can put an ice pack up here, because you will, under your clavicle here, you will get swollen. Keeping that swelling down a little bit will help, and it will also just be distracting. If you have a tummy tuck and you can ice pack your flanks, even warm if you have like chronic back pain, heating pad your lower back if you don't have lipo in that area. There are just all these different areas that you can ice if your surgeon doesn't want you necessarily icing the area that you had surgery on. I would ask, and if they're okay with you icing, ice. If they're okay with you icing, I would not go 4 hours throughout the first night without icing. Keeping that swelling down. One thing you want to remember is a lot of times the pain and discomfort is from swelling. And so if you can keep that swelling down, you're going to be good to go. Okay, what else can I tell you? A positive attitude going into surgery really will help. I'm hoping that this information will just kind of help you feel like a little discomfort's gonna be okay, you got this, and that you have some tricks, you know, in your back pocket. Really, you know, don't underestimate the value of icing. Keep any compression garment on, and good luck to you. Happy healing. Hit me up below with any comments or ideas or questions for other videos. Thanks for watching. So in this video series, I'm going to teach you the 6 fundamental things that will ensure a great recovery after plastic surgery. I'm also going to teach you and show you how to manage your dressings and drains, how to prep your space for a great recovery, and I'm going to teach you about nutrition, what to eat before and after surgery to fuel the best recovery possible. Don't just survive this, I want you to thrive. I want you to take this opportunity and really do a great job preparing and then reap the benefits. And we're talking about all the things that are going to guarantee you a great recovery. So let's get started.